Hello again. This is Athena Jezik, and I'm going to be working Karina's back today. I have to tell you that lately I have been getting so many people coming in here with back problems down in the lower back and in the hip area. So I thought I would go through some massaging, although a lot of the people that I've had to work on are needing much more advanced work to be able to really work everything out, and the massage is just kind of a finish up for them once the tissues have been reorganized. I do some massage with them, although the reason they don't need to come back, except for maybe a follow-up, is because after the work is done, they do feel better, and that is due to the fact that I do the subtle anatomy work on them first. And that again is part of the course that I'm teaching. But it gets people back up, and I'm actually surprised because sometimes I wonder if I'm doing anything for them, because the massage doesn't feel like it's really getting to the muscle area of the pain. But the next day they're always contacting me and they're saying, yes, I feel so much better. And oftentimes they don't need a follow-up, so I just want you to understand there's a lot more than just the muscles. But I will show you the basic muscle work, and of course the spine is the most important thing that we should be paying attention to. So here I'm starting, of course, with my thumbs going across the shoulders, getting into the shoulder blade area, and we do have some crepitus in here. So here I'm just going to be opening up the trapezius from the center to the scapula, because there is a lot of tension through here, and get started there. And then run down the entire back to the very edge of the sacrum. Now we want to pay attention to the fact that the spine has nerves that come off of it, and they're in the dural sleeves, and they go to the organs. And so the stimulation that happens from the nervous system to the organs will be affected by the positioning of the back, the alignment, and all that stuff. So this is just going down the erector spinae and then coming up the erector spinae. Feeling the muscles, not getting too awfully deep, but letting the muscle tell you how deep to go. And then coming around to the side, I'm going to open up the shoulder. The thing about the cranial system, and which is the dural tube that goes around the spinal cord and around the brain, is that's a very vital structure to have in order, because there's so much that goes on at a subtle level with the higher frequencies that are connected into that particular structure. And that's why it's a modality that can really help a lot of different situations that you wouldn't think could. And then on top of that, once that is nice and corrected and aligned, then the muscle work is much more efficient. So even if you just want to work the muscles, if you have an understanding for that system, and give your clients a chance to come into that system and have that aligned and organized, you're going to do a lot better for them, even with just the muscle work. So we're just going up again. Now we're doing an upward push of the same muscles that we started with. A lot of the things of the subtle work that I start to share with people is all stuff that has been researched out, and there's been a lot of tests and things like that being done to really see that there is a lot of connection with these higher frequencies that we don't really understand yet. When I did massage a lot more, I always started them down, face down, partly because the back is usually the one that shows the tension the most, and they feel comfortable and able to relax without feeling vulnerable. So now I'm just going along the trapezius muscle, following that, and then getting into the attachments along the scapula. And working up. And you know, the trapezius is kind of a triangular shape muscle. And then I'm going to go along the scapula here, round it out. Now here I'm just taking the thumb across the low back area and softening up that, and then I'm going to take the thumb, the two thumbs, putting together and gliding them up right along the vertebrae. All the way up into the neck and up to the base of the skull. Okay, so let's do one more. I like to do things in threes, and that's on the more lateral edge of the erector spinae. And it's pretty, you know, it's a muscle that you can distinguish well in most people. And the name of that muscle, you can tell what that is, erector, so we stand erect, and the spinae with the spine. And then I'm just doing a little back and forth cross fiber friction going over. I'm only on the erector muscle here. So I'm going from edge to edge of the erector muscle. So now you go to the other side and repeat that. So you start up here at the neck and work down. So when you're working, you can begin to, you know, if you're just starting out, you're going to need to concentrate on the muscles and where they are and what you're doing and get this stuff into your hands. But if you're a more seasoned massage therapist, then you can begin to think about the more subtleties. And there is energy that works through the hands. And it's very important that you learn what to feel with the energy and how to work the energy as well. And sometimes you'll feel kind of kind of a electricity or magnet or some kind of a feeling underneath your hands. If you do feel that, then that's an energy thing. You're not directing energy, you're just flowing with the energy of the body and your hand. One thing that I have noticed over the years of doing this is when the subtle anatomy is in alignment, the muscles are in a much better position to work. When the body is out of alignment, then you're dealing with muscles that are not in alignment, and so you're not going to be able to do as much with them in the way of correction. Of course, people will still feel good, but if you're wanting to get into the higher level of this work and what I call the healing artist, it's very important to understand the subtle anatomy and how to work it, and how that relates both to the more physical parts of the body and also the more subtle parts, the subtle higher frequencies. Okay. Now this has softened the muscles that are attaching into the spine. So then we're going to do another little technique where you roll from the spine, you just roll the thumb and pick up it's like you're picking up this muscle and getting down deeper into it. It's a very nice feeling to do that. It kind of stretches that muscle away from the vertebrae. And you can do it with your thumbs, and then I'll show you how you can also do it with your fingers on the other side, and then you can come back down. This is just like a brush back down. And then on the other side, you can take your fingers and pull it as well. So there's different ways of doing this. I'm still getting down under that muscle and picking it up. So you can kind of see which side, what works best for you if you're doing this. And you can really feel the stretch going. You can actually feel it a little bit more with the fingers. It covers a little bit more muscle when you're doing it because you have really two fingers on it. All the way up, and then brush back down. And then we're going to run up again on either side. And to the neck. And then go separately around each vertebrae. Just kind of opens up the vertebrae. Gives a little stimulation in between each bone. One thing that I have noticed over the years of doing this is when the subtle anatomy is in alignment, the muscles are in a much better position to work. When the body is out of alignment, then you're dealing with muscles that are not in alignment, and so you're not going to be able to do as much with them in the way of correction. Of course, people will still feel good, but if you're wanting to get into the higher level of this work and what I call the healing artist, it's very important to understand the subtle anatomy and how to work it, and how that relates both to the more physical parts of the body and also the more subtle parts, the subtle higher frequencies. I'm going to take my two fingers and get at the very base of the skull, tuck my hands in, and do a little vertebral vibration down either side of the vertebrae. And then across the hips and sacral area. And then run back up through with both thumbs, either side of the vertebrae. run this back up. Until you get to the neck. And then we're going to do another vertebral vibration down for a second one. And then we will run the thumbs back up. And I'm just rubbing this up again, continuing to go up that spine and making sure that there's not any tension in these muscles. Okay. So then once here, and we get that all done, then I'm going to do this vertebral, the vertebral vibration, where you're just going back and forth with kind of shaking very gently either side of the vertebrae. This gets a little bit more into the connection where the muscles are attaching in. Now here I'm pushing upward. What happens when you go upward is the vertebrae opens. When you're coming down, it kind of closes, and when you're going up, it's kind of opening each little vertebrae. So that's another reason why you want to go both directions. And so my thumbs are just on either side of the vertebrae, and after you get your hands working pretty good, I'm not only just pushing up, but I'm also spreading those connecting parts of the erector spinae to the vertebrae. So there's like a double action. It's an upward flow as well as an outward stretch. And then get into the neck a little bit. Okay, and then we want to just go with the fingers between each vertebrae and just get some stimulation in there. You know, because you're going in and you're very close to the spine. I do have this routine where I paid a lot of attention to the spine, and I did this before I even understood about the cranial sacral therapy, because I did work in massage a couple of years before I went into the cranial work. And so I sort of instinctively knew that the spine was a very important thing to work, and now I know why I was doing that. Because it is very important, that nerve. That's the electrical system of the body, basically. And then you want to do some sweeps open, where you're just spreading the fingers and just letting the muscles stretch all the way down. Now when you get up to the rib cage, find the ribs and go between the ribs. So I was telling you earlier that I've been seeing a lot of really strange pain patterns with people. And the way that I work that is I go to the basic protocol that I teach in the class, to get the subtle alignment there. And sometimes then I will work, most of the time in fact, I'll just work into the tissue. Even if it's on the back, they're still laying on their back and I'm working into the back, because I'm allowing the tissue to reorganize. And after one session, some of them don't need to come back if they're not super bad, but oftentimes people come back for a follow-up, and then I'll get into the muscle and actually do a little bit of massage into that muscle, and that is like putting the frosting on the cake, because that's what then completes what they needed. So it's not like massage isn't important, because it is, but you're not going to be able to get into the correction of the sciatic pain, or even help realign the discs if they're not too awfully bad. And avoid, a lot of people that I've worked on have avoided surgery with discs. And I'm just running my finger down there for that, and then pulling this up again on this side. So I'm hoping that you are beginning to see the importance of what bodywork can really offer. And it's at many levels. And I do hope that those of you that are called into this just take the time and take the steps and step up each rung of the ladder. Feel comfortable and master wherever you're at, and don't worry about it, because there's something kind of magic that happens, is that you're going to get the people that you can handle best. And they'll find you. You don't have to be at my level, in a week. And you shouldn't be. But one thing I will say is that if you do understand a lot of things I'm teaching you, you can do it quicker than I did, because I had to figure all this stuff out over time. Because there wasn't really a connection between all of this stuff. So it was just bits and pieces here. It was either off body, on body, doing this kind of thing. It wasn't ever put together as an entire unit. And then you can handle emotional things, psychological things, and all kinds of different pain. Okay, so then all this, and then you should feel the muscle being softer. Now, sometimes what I have been noticing is some of the injuries or the pain that's coming up in people is that they have had previous injuries, and there's scar tissue that we're dealing with, and the scar tissue is very difficult to work with, because it's like spaghetti noodles, and it just holds the muscle down. And so that is where a deep tissue work is important, but you do have to get everything ready for that, because if your body's not aligned and you're just working the scar tissue but it's still crooked, you're not going to be able to get that pain completely out. And that stuff does take time to get out when you have scar tissue. So that's another thing that I'll be covering in the course. And also, I do have the newsletter that I write a lot of this stuff out. I don't go nearly as deep in the newsletter, but for some people that are just interested in learning exactly what it is without the calling of actually having the hands-on work. So I'm trying to offer a lot of things to people for the betterment of their understanding of just who we are. And when we start feeling better and we start to come into a really good balance, that's when we can be productive, and that's when we can be much happier, because that's it all connects, the moods and all that, it all connects in. So with that, I want to say thank you so much for viewing this piece that we did. And I also want to let you know that if you are interested in learning the subtle techniques, please take a look at my class and join the class. It's really a vital class to take. So check the link below the video, and you can check for the class there, and you can also check for the newsletter. So thank you again so much for viewing, and appreciate you. Give us a like, share this if you want to, and also please subscribe. Thank you so much. I want to invite you to explore my course, The Foundations of Subtle Alignment. It is going to take you beyond the work of massage therapy. It will take you into the world of the subtle anatomy. Misalignment of the subtle structures is often the root cause of chronic pain, injuries, and chronically high levels of stress hormones. These techniques offer profound benefit whether you are working on people with complex issues or not. In this course, you will learn about the subtle anatomy and a protocol for assessing and aligning the subtle structures.